Hey friends, welcome to another myofascial release video. Today again, we're going to be approaching our fascia in a way to try to release those adhesions. And as always, what we're looking for is to find that target area, apply that direct pressure to the spot that feels the most tender where we get that good adhesion, and just wait and be patient and breathe until it releases. Today we're going to be going over a really important area of the body. This is perhaps, in my opinion, one of the most crucial areas to get released because it's one of what I like to call the keystone areas of the body. If we don't get rid of the tension in this area, a lot of the other work that we're doing isn't really going to do us a lot of good until we do get rid of it. And this area is something that I guarantee you felt tension in without even knowing you. And this is in the back of the neck. Now there's many muscles in the neck right here, and we could address all of them, but we're going to be talking specifically here about a little bit of soft tissue up here called the suboccipitalis. Now, if you take two fingers and you find your ear, back here behind your ear, you'll feel the back bottom ridge of your skull right here, and that's called the occipital ridge. So right below that, that soft tissue, not the bone itself, but the soft tissue under, is of course the suboccipitalis. Now, more important than what this muscle is called is how we're going to approach it and how we're going to get that release. So for this one, I like to, again, use the block to bring the ground up a little closer so that we can really get deep. Some people like to do it on the ground. It feels better to you. You can do it that way. But the real key, as always, is to get that spot and get that release. So I'm going to use a ball. I like to use a little bit bigger size of a ball for this one just so we don't put too much direct pressure on it. But I've used all sizes of balls and it all works out fine. Now what we're going to do is we're going to lie down and be careful here to make sure that we just rest our head gently on this block like a pillow. Now, I don't want the edge of this block to be digging into my neck at all. I should feel pretty comfortable here. I'm then going to take the ball here on my right side so that you can see, and I'm going to just put that ball under that little area just below that occipital ridge of the skull. And then I'm just going to kind of roll my head a little bit to the right. Now, again, I like to kind of keep a hand on the ball because this area tends to be a little rolly. It tends to roll off. It tends to move around a little bit. So we're going to try to hold it in place just gently. Now, I might feel these adhesions out closer to the ear along that ridge, but sometimes I feel them a little bit more close in towards the actual spine. That being said, it is very important that while you're doing this, we don't roll onto the spine itself. You do not want to put direct pressure with this kind of an object, or really any object, on that part of the spine, on that cervical spine. So I'm just going to find that little adhesion. For me today, it's a little bit closer into the spine side, but again, not on the spine. I'm going to rest there. I'm going to wait. As always, breath, patience, trying to relax internally until I feel that spot give way. Once it gives way, again, I could move probably even just a little bit, find another spot, and we can keep working our way around. But as always, once you get those releases, do make sure you do the other side. And again, even if you're a person that feels like, man, all my tension's on that right side of the neck, maybe start there, but do make sure that we do both sides, because this idea of the fascia, it's a little bit more complicated than just I feel it here, so I give it there. So make sure you do both sides, get that neck release, and notice you'll feel a lot better almost right away after you do this. Maybe even give your head a little movement so you can notice how much easier it is to move.